Science shouldn't feel like a closed door. Welcome to Human Verified, your backstage pass to the world of high-stakes research and the business of staying alive. My name is Gina Winchester, a Native American scientist, professor, author, and I've created this space where we swap dense academic jargon for fresh, no-nonsense insights. Whether I'm deconstructing pharmaceutical breakthroughs, clinical trials, or the how this is legal side of STEM business, I'm here to bridge the gap between the lab bench and your daily life. It's rigorous research met with real-world storytelling because understanding how science works is the ultimate power move. Look, the FDA be trippin'. Get lifted. For veterans returning from the Middle East, coming home can feel like a second war characterized by invisible wounds. Roughly 1 in 5 who served in Iraq or Afghanistan deal with PTSD or depression, often sparked by the constant threat of IEDs and the emotional weight of moral injury, which is the psychological burden of impossible combat decisions. With the ongoing conflict in Iran and the likelihood that it will continue long after the Strait of Hormuz has been reopened, mental health struggles have never been more important for soldiers, veterans, and civilians. But these struggles aren't just mental. They are deeply physical. This creates a nearly insurmountable problem that makes traditional talk therapy feel like trying to fix a computer with an update that just won't complete. The stakes are incredibly high as veterans face a suicide risk of 60% or higher than the general population, losing about 17 people every day, many of whom are completely disconnected from the support systems they need. The story of Marcus Capone, a former Navy SEAL with 7 combat deployments, highlights how desperate this crisis has become. Trapped in a spiral of rage and depression that traditional medicine couldn't touch, he eventually turned to ibogaine, a powerful psychedelic. For Marcus, it wasn't just a trip. It was a high-speed life review that silenced the constant fight or fright alarm in his body for the first time in 10 years. This isn't just a single miracle story either. A major 2024 Stanford University study found that veterans using these treatments saw their PTSD and anxiety symptoms plummet by 80 to 90%. This data is why organizations are fighting for access, viewing these interventions as a total system reset that allows a veteran's mind to finally, truly rest. However, this breakthrough has sparked a debate in the medical world over what actually does the heavy lifting in recovery. The first view, often called drug therapy, treats the psychedelic like a standard antibiotic, meaning the chemical itself is the healer and the therapist is just there as a scaffolding. This model is favored by the Food and Drug Administration and federal regulators because it's easier to approve a pill than a process. On the other side is psychedelic-assisted therapy, which argues that the drug is merely an assistant that opens the door for deep psychological work. In this view, the therapy sessions are the most critical part of the safety and success. This creates a regulatory headache because the government is racing to approve the drugs, but they still haven't figured out how to evaluate or pay for the intensive human therapy that many experts believe is the real secret to the long-term healing. And it's not just for veterans. Recent research and late-stage clinical trials are examining the use of certain psychedelics in the treatment of severe mental illness across the United States. It's no surprise, then, that the government has finally made a statement. The White House Executive Order. On April 18, 2026, the federal government took a major leap forward in the area of severe mental health treatment. A new executive order titled Accelerating Medical Treatments for Serious Mental Illness was launched to speed up the development of psychedelics in everyday healthcare. The policy focuses on treatment-resistant depression and substance abuse, where traditional pills and talk therapy just haven't moved the needle. To get these treatments to the average person, the executive branch is exerting its authority over federal agencies, which are also under the executive branch, to push this forward. Some of these therapies are now at the front of the line, getting special priority vouchers that can cut the wait time for approval from many months down to just a couple of weeks. The policy specifically names ibogaine, which is currently being studied for its ability to help people break free from addiction and deep-seated trauma. To make sure this works, federal agencies like the Veterans Affairs and the FDA are being told to stop working in silos, start sharing their data with other researchers, and with private companies. The president is also putting direct pressure on the Drug Enforcement Agency to stop the delays and give doctors the Schedule I permits they need to handle these substances. Essentially, the FDA is being tasked with building a bridge so that once a drug passes its basic safety checks, patients can start using it legally without waiting years for every last piece of paperwork to be filed. The executive order also taps the Right to Try Act. This gives doctors a legal green light to provide experimental psychedelics to patients in desperate need before the drugs are even fully approved. Then it generates a new rule requiring the Attorney General to immediately review the legal status of any psychedelic drug that finishes its final stage of testing. This ensures that as soon as a drug is proven effective, it can be moved into the hands of healthcare providers. To help foot the bill, the federal government is offering $50 million to match what states are spending on their psychedelic research, which supports efforts already happening in places like Texas. However, the real test of how easy these drugs are to get will come down to the safety rules the FDA sets. These rules will decide if you can pick up a prescription at the pharmacy or if you have to go to a highly supervised clinical setting similar to how ketamine is handled today. Psychedelics and mental health treatment. When we talk about ibogaine, we're looking at a powerful compound found in the Tabernanthe iboga plant that is famous for triggering intense dreamlike hallucinations. However, the excitement around ibogaine is balanced by some very real safety concerns. The most significant red flag is that it can be dangerous for the heart. Another red flag is that these substances create a state of profound vulnerability and suggestibility. Being in an altered state can create a massive power imbalance where a patient might view their therapist as a savior, a dynamic that requires extreme professional care to manage safely. Then there is the debate on the physical boundaries and the use of touch. During an intense emotional breakthrough or a moment of fear, a patient might instinctively reach for a hand to hold, or a therapist might feel that a grounding touch on the shoulder is necessary. While traditional therapy usually maintains a strict no-touch rule, psychedelic work sometimes views ethical touch as a therapeutic tool. To prevent any risk of misconduct, the industry is moving towards rigorous, pre-approved protocols where the patient and therapist agree on exactly what kind of physical contact is allowed before the session even begins. A major red flag is that a psychedelic session can shatter a person's old coping mechanisms or force them to face repressed traumas all at once. If a clinic simply provides the drug without a robust long-term integration support, they risk leaving a patient more fragile than when they started. It's a high-stakes balancing act between a drug's potential to change lives and the risks it poses to the mind and body during the process. Combination therapy and psychedelics. Combination treatments can include a couple of different methods of talk therapy. One example is acceptance and commitment therapy, which uses a specialized 3-step process known as preparation, support, and integration. It starts with preparation, where a patient and a therapist build a foundation of trust and set a clear intention, basically pinpointing exactly which emotional hurdles the patient is ready to face. This phase is all about clearing the mind and lowering anxiety so that when the medicine takes effect, the patient is open to whatever the mind might reveal. When the actual session begins, the therapist shifts from being a guide to being a quiet guardian. They aren't there to give advice or ask probing questions. Patients often block out light using a mask and listen to a curated playlist, turning their focus entirely inward. The therapist stays close by to offer a steady hand or a sip of water, but they don't steer the ship. They trust the mind to lead the way through the healing process, acting as a safety net while the patient explores their thoughts. Next comes integration. Once the medicine wears off, the patient spends several sessions unpacking their experiences. The goal of integration is to make sure that the temporary effects of the drug don't just evaporate like a dream, but instead anchor a permanent change in the patient by providing insight they might not otherwise have been able to achieve. There's a core belief that your mind already knows how to heal itself once its usual defenses are lowered. Instead of a coach giving you homework, the therapist acts more like a translator, helping you anchor a massive shift in perspective so it becomes a lasting part of your personal story. Another approach is internal family systems, which is built on the idea that the mind is made up of different components, such as a protector that uses anxiety to keep you safe, or a wounded part that holds onto old trauma. During the psychedelic session, these different parts of the personality often become very vivid, and the therapy focuses on healing these different parts. There is also a strong emphasis on mindfulness-based cognitive therapy. Mindfulness is a more common term that the everyday American knows, and here it serves as the daily practice that keeps that window of change open. It provides the patients with tools to stay grounded when the experience gets intense and helps them stay aware of their thought patterns long after the drug has left their system. The common consensus is that applying a drug treatment alone in mental health is unsafe and can cause more harm than good. By ensuring that this new drug treatment pathway is paired with a form of talk therapy, the therapist can create a safe space, not only physically, but mentally, for the patient to make progress. This creates a whole new set of mental health offerings, which is why we're going to finish up this editorial by looking at the business of psychedelic mental health treatments. Is psychedelic mental health treatment a burgeoning business in the making? The evidence is clear that combining advanced therapy with psychedelic treatments is a major breakthrough for serious mental health conditions. But as we move forward, we have to look honestly at the multi-billion-dollar industry this creates. When that kind of money is on the table, it can easily skew the ethics of how these treatments are rolled out. Unlike almost any other field, we're talking about using powerful pharmaceuticals to put patients into an incredibly vulnerable psychological state, often in a room alone with a single provider. If we aren't careful, the same pure capitalism that drives innovation could lead to cutting corners, which puts a fragile population at risk, an outcome we simply cannot accept. While I've always maintained that science is good business, this is a situation where the implementation is just as important as the discovery. For too long, the mental health industry has leaned into a pill-a-day model because it's a reliable way to drive revenue through years of prescriptions. That model has its own risks, but the risk of this new model is that instead of making money on a monthly bottle of pills, the value is shifting towards infrastructure. This expensive venture includes high-end clinics, certified facilitators, and many hours of professional support required to keep a patient safe. That costs millions and has a potential to make companies billions. Psychedelic combination therapy marks the birth of a brand new service-based economy within healthcare. The product isn't just the drug anymore. It's the entire experience and the specialized medical facilities designed for these long, deep dive sessions. As we look at the numbers behind the recent executive orders, it's important to see them clearly, without judgment, but with an understanding of how they might pull at the ethical fabric of this work. We have to ensure that the drive for profit doesn't outpace our duty to protect the people who are finally finding a path toward healing. That is an important point when we discuss the business of psychedelics in mental health therapy. The way we decide to categorize psychedelic treatment isn't just a matter of semantics. It completely dictates how these therapies will be rolled out, who can use them, and whether insurance or Medicare will ever pick up the tab. One method would be the pure drug therapy model, which views the psychedelic as the primary driver of healing. The danger here is that it invites the same capitalist incentives we see in the pill-a-day pharmaceutical industry, which might tempt companies to prioritize efficiency over safety, potentially leaving vulnerable patients to navigate intense psychological experiences without enough support. The other method would be the assisted therapy model, which treats the drug as a powerful tool that simply opens the door for deeper, more effective psychotherapy. It is still unclear which path federal regulators will ultimately choose. The White House's recent executive order was a starting point, but the real heavy lifting now falls to the FDA. So far, they seem to be leaning toward a traditional drug discovery model. This means that instead of picking up a prescription at a local pharmacy, patients would likely have to visit highly supervised, specialized clinics to receive treatment. This regulatory preference for a controlled environment is a clear attempt to manage safety, but it also solidifies the idea of psychedelics as a clinical procedure rather than just a medication. We are also witnessing a profound transition as these substances move from the shadows of underground and religious use into the light of a federally sanctioned medical industry. While the business incentives are immense, and the government is finally putting real money on the table to link state and federal research, we are still in the early chapters of this story. For now, the official focus is staying strictly on the business and medical side of the house, sidestepping the complex debates over religious and personal use. The immediate goal is to build a framework that stops treating mental health as a lifelong subscription to a pill and starts treating it like a high-impact service that could fundamentally redefine what it means to heal. Ripples across the broader economy. Healthcare business insiders focus on the cost offset strategy of psychedelics in mental health treatment, which could save the economy billions. Right now, untreated mental health conditions are a massive drain on employers and insurance companies due to lost productivity, disability claims, and emergency room visits. If a treatment like ibogaine can move a patient into long-term recovery in just 1 or 2 sessions, it essentially eliminates the need for decades of expansive daily chronic care. This one-and-done model shifts the revenue away from long-term prescriptions and toward a high-value service model. Instead of a profit coming from a monthly pill, it comes from the intensive, multi-day medical stays required to administer these treatments safely in specialized clinics. However, turning this into a scalable industry presents a few major hurdles, particularly around the intellectual property and staffing. Because many of these substances occur naturally in the wild, they are difficult to patent, leading biotech companies to engineer next-gen versions that are easier to protect legally and faster acting in a clinical setting. In the ibogaine space specifically, the industry is split between those providing the natural compound and those designing safer synthetic alternatives. For instance, Optimi Health and Science Biomed are building the supply chains for pharmaceutical-grade botanical ibogaine, while firms like Gilgamesh Pharma and Atai Beckley are developing new molecules designed to remove heart-related risks. The goal for these companies is to create a product that fits more neatly into the standard FDA approval process and mainstream medical systems. Beyond the molecules themselves, the priority vouchers are worth hundreds of millions of dollars because they can be sold to other pharmaceutical giants to fast-track any drug through the FDA. On top of that, the federal government has unlocked that $50 million in matching funds to partner with states like Utah and Arizona that are already funding their own clinical trials. This creates a powerful public-private partnership that allows companies to double their money while building the medical facilities and training the professionals needed to meet the demand for mental health solutions. Strawberry fields forever. It's clear that even with the questions surrounding the capitalist incentives for bringing psychedelics into the mental health care market, taking this treatment out of the back room and into a controlled medical setting is a good thing. Regulations would ensure that this treatment is less of tie-dyed themed trip and more of an insightful journey focused on healing past traumas. This is just the beginning, and as it moves along, we'll keep exploring the human-verified implications of psychedelic combination therapy. Thank you for spending this time with me today.